Here we are on Part 10, page 978 in the urinary system, just the way you like it. And we were talking about the use of inulin as a control or a standard in order to measure all the other things that might be coming through. Try to bear in mind that when we think about urine, urine is a direct filtrate of the blood. So it's going to tell us something about our blood. For instance, if we find hydrogen ion in the urine, which is to say the urine has a pH maybe of 5 or 5.5 compared to 7. Remember, the blood wants to be between 7.35 and 7.45. So basically, if you see anything that's away from 7.35 down toward 5, that means, oh my goodness, I've been really pulling some hydrogen ion out. I must have a very acidic, highly buffered blood. If your urine instead is more like 6.5 or 7, then you say to yourself, oh, okay, I've had a more balanced diet, and I'm not relying on meat and wheat and things like that for nutrients, and I have a much more neutral. If you go all the way to like a fruit fast or something, you end up with a very alkaline situation, or if you just eat veggies. Okay, so let's take a look here at what they say. A clearance value that's less than that of inulin. Did you catch that right here? A clearance value that is less than that of inulin means that the substance is reabsorbed. Okay, so it passed through with inulin, but it also got reabsorbed, so now there's less of it. For example, urea has a clearance of 70, and inulin was 125, right? And so that's comparing that to 125. That means that some of it, possibly 70 divided by 125, that percentage is what's being removed. Okay, and so you can get all kinds of little, 70 minus 125. That means 55 has been recovered. Alrighty, so see if we have that clear in the mind. They're comparing that to the standard here of 125, and we come this way. So approximately 70 milliliters is completely cleared. That's what's in the urine right now. And while the urea in the remaining 55 milliliters is recovered, okay, and returned maybe to the plasma or maybe to the interstitial fluid, because remember, we're using some of that urea in order to create tonicity. So if the C value or the clearance value is 0, such as for glucose, in healthy individuals, reabsorption is complete, or the substrate is not filtered. Okay, so glucose can be filtered. It's a small molecule, and so that means the reuptake is complete. The exception to that rule is the individual who is a diabetic, or somebody who is completely absent of insulin, and that means the glucose builds up and actually challenges what's called the transport maximums. So whenever we're trying to transport molecules, there are maximums that can be reached. So if the clearance rate is equal to that of inulin, there is no net reabsorption or secretion. So it's basically has the same sort of value as inulin, and it's sort of going through the same experience. If the clearance rate is greater than that of inulin, so how can that be greater? Because inulin is completely filtrated and none of it is reabsorbed. So how can you get a value that's higher than inulin? So it says here the tubule cells are secreting the substance into the filtrate, right? So not only are you filtering, but you're actually secreting extra in there. This is the case with most drug metabolites. So we break down our drugs, there's a half-life, and they actually get secreted. The body doesn't want it. Knowing a drug renal clearance value is essential because if it is high, the drug dosage must also be high because basically you've lost the drug now. It's not having an effect. Or the other option is that you administer it more frequently, which is probably the safer option. Then we have creatinine, which has a clearance rate of 140 compared to 125, which means that it's all being filtered, and then some of it, in addition to that, is being secreted. So we get a cumulative 140, which is greater than 125. Okay, so then we're going to be talking about a few other things here. Renal failure generally simply means that the blood pressure is so low that the kidney can no longer do its job. There's a number of other reasons for that. It includes just organ decline, general fatigue, things like that. Uremia, which means blood. Urine, let's read this, urine in the blood. Okay, so while it says here uremia was once attributed to accumulation of nitrogenous waste, particularly urea, we now know that uremia is not especially toxic. Urea is not especially toxic. In fact, it's used as a tonicity item. Rather, the multi-organ failure is caused by the interplay of multiple factors, particularly ionic and hormonal imbalances, which is to say, in the big picture, there's a relationship between the kidney and many other organs of the body, particularly the heart. And sometimes the heart is not up to the task that the kidney is requiring, okay, to create adequate pressure and so on. So we'll press on then to the next detail here, which is the physical characteristics of urine, color and transparency. Freshly voided urine is clear. We use the term void because we need our patients to leave the hospital room with no urine, especially if they've been intubated down there in some way in order to have like a facilitation for surgery. If the surgery is going to be long, that means we have to catheterize because that person is needing to get rid of their urine. The bladder is filling up, in which case we've introduced possibly bacteria into the bladder, and we want to void. We want the patient to completely urinate and have no urine left. And this is a way of sort of cleaning out the bladder in case we've introduced bacteria. Okay. So that's part of the program there. We have various color transparency issues. It says here that any abnormal color, such as a pigment of brown or some sort of smoky color, may indicate something that could come from the diet. Oftentimes it also could mean that there's some problem with for instance, the liver, that there's bile pigments, or that there's drug issues. And we could also be considering cloudy urine to be an indicator of infection sometimes. Okay, so the odor, fresh urine is slightly aromatic. It has very little smell. If allowed to stand, it becomes quite strong. And there's sulfur, hydrogen sulfide types of things that develop. So basically, standing urine is not pleasant at all, but initially it has very little odor to it. Some drugs and vegetables are going to be altering both the color and the odor. For instance, beets will color the urine red, and things like asparagus will give a special result in terms of odor. Okay, the pH is also a reflection here of what's needed. The pH can go from 4.5 to 8. Basically, the blood has to be 7.5 4 or close to that, so close that it cannot leave 735 or 745. That's the range. You just get that narrow range, and it's buffered. And so in order to help, the kidney is getting rid of hydrogen or sparing hydrogen one way or the other. But the idea here is that most Americans eat enough meat and wheat that we end up with a pH pretty close to 5 or so. If we have very, very little meat and wheat, we have lots of vegetables and fruits and things, then it's going to be a little bit more neutral. That might also indicate to us what our real food should be.